Oprah Winfrey once said, "There is no such thing as failure. Failure is just life trying to move us in another direction." With that beautiful
with
quote,
a beautiful
let us begin with our today's session, which is Wiki Presents our Health and Medical Forum. And we are here with us, beautiful guest, Dr. Swati Shirsagar. We welcome you, Dr. Swati Shirsagar.
Thank you. Thank you
And
for having
we
me.
have we have our moderator today, Dr. Shilpa Bansal Chavan. So before we deep dive into our today's discussion, let us know what Dr. Swati Shirsagar does. She is founder and director of Precision Diagnostic Center, Borivali. Stood second in her MD Mumbai University examination. She has headed a radiologist department of Wokhad Kalyan Hospital. She is ex-consultant radiologist at Leelavati Hospital, Mumbai. She worked with Cloud9 Hospital in Malad. A passionate radiologist and compassionate human being, she has a strong desire to provide state-of-art diagnostic services to people from all walk of life. She is specialized in women's imaging. She has traveled across the globe to acquire and obtain knowledge and has done fellowships in fatal. She is on mission to create awareness about breast cancer and conducted breast cancer awareness workshops for corporates, women organizations. She is working with few leading NGOs in India. She is also an honorary DNB teacher for budding radiology students in Municipal Corporation Hospital, Dr. Babasaheb Ambedkar Hospital in Kandivali West. She believes in holistic health for all. With this lovely, introduction, we welcome Dr. Swati Shirsagar to our platform, and we want to know more about how you started off your journey and what is it now going ahead with it.
Yeah, thank you for that wonderful introduction. I really felt nice listening to all that. So just to start with, I completed my MD in 2001 from Mumbai University. And post that, I'm into private practice. I was fortunate enough to have experience and to having the achievements in the leading corporate hospitals like Wockhardt and Leelavati Hospital from Mumbai. But the main modality which I am into, being a radiologist, everybody is aware that there are several modalities like cross-sectional imaging, like CT, MRI. But my main modality is ultrasound, and that's very, very dear to me. So I can say that now in among the radiologists also, we work like a super specialist, especially means we have our specialization according to the modalities. So we can say that our super specialty is into ultrasound. Now we try and offer the maximum imaging, whatever we can do with the help of ultrasound. And when ultrasound was when we were as residents back in from 1998, ultrasound has evolved like anything. Earlier, it was considered as just a basic investigation modality, but now it has reached to a level where it is become a better alternative than even MRI in certain disorders, especially when it comes to women's pelvic imaging. So with the high-end equipments, what we have now in ultrasound, I can say that. So we will be talking more about in detail later on. But today, now after 20 years, when I look back, so we have grown along with the growth of the ultrasound. So we have witnessed the every phase of that, and we consider ourselves very fortunate to witness all this journey. So this is how the journey of ultrasonologist, if you have to really term it as.
Superb. I think today's discussion would be very inspiring and with a lot of information, because these days what we are seeing, there are hundreds and 200s and thousands of cases which are coming up on cancer, and women's, they keep quiet, they don't come up, they don't speak to doctors, they don't speak to families, and unfortunately it takes to a different level altogether. So let's begin with our session today. Instead of what women want, we would be discussing what women need when it comes to health. And now I welcome Dr. Shilpa. She is a consultant dietitian and she runs a multi specialist clinic in Mumbai. Over to you, Dr. Shilpa.
Yeah. Thank you so much, Mamta ji. And thanks for that beautiful introduction and also to invite. Hello and a warm welcome to the interactive talk show on the Wiki platform in the Health and Wealth Forum today, Wellness Forum. Today we'll talk about women's imaging specialist, Dr. Swati. Now, she usually we say image consultants. So we have seen image consultants outside who coach us to be beautifully outside, dressed up and things like that, and how you present yourself. But here we are speaking something entirely different, how to be, beautiful inside. So we have an imaging consultant who is specializing in women's image consultancy, and she will be talking about the details as to what is very necessary imaging during the complete life history of a woman, right from when she's becoming a mother, and the various phases of life at menopause, what could happen, and things like that. So when we are talking about her, to Dr. Swati, at about Precision Diagnostic Clinic, where all these three modalities are present, that is radiology, ultrasonography, and mammography. So these three diagnostic services are very important, and it's like a small complete thing in itself. So when somebody needs an x-ray, go ahead, get an x-ray. And if some specialist or whoever the doctor is treating find something which also needs a sonography, one can just go ahead and get a sonography done. And if something else, then a mammography is also available. Now these three words everybody is using, they are common, they are aware, but to be at one place is again indeed important, because you're not going round and round and not finishing the things, you are doing just at one place. So that puts in a lot of things together, and we get all the expert opinion at that place. So diving into the subject, we are going to get lots of information from the expert herself, like in radiology, when we say okay, get an x-ray chest done, or get a x-ray cervical spine done for your spondylosis, or for you have osteoarthritis, you get a knee joint x-ray done. If you have a backache, you get a x-ray back done, and things like that. So these simple things, we should know, we should be aware, and we should get it done as and when required, or as and when our doctor tells us. It's simple and it's not harmful, so one can overcome all these myths and go ahead. Similarly, in ultrasono, we can also find out like the pregnancy, in case a pregnant woman goes in, how to match the number of weeks with the age, so the gestational age, any kind of deformities, abnormalities, or any other small things. Nowadays, PCOS, PCOD, so much we hear amongst young women. So how does what is to be seen in ultrasonography about that, and all these things, we'll know it better from the expert. Similarly, for mammography, the only test diagnostic is mammography. They say it's painful, there are so many myths. So all this are going to be just cleared off and clarified by our expert, Dr. Swati. Yes, so now you're going to talk to us about what exactly you do as a women's internal imaging specialist. Yes, Dr. Swati.
Yeah, as I mentioned, my main modality. Yeah, can you hear me?
Yes, please go ahead.
So my main modality is ultrasonography, and as you rightly mentioned, internal imaging, generally it is inferred as a internal examination, mainly for the pelvic organs. Now there can be different requirements for this. The commonest one which we get, that again differs from age to age. Now here I would like to broadly divide it into unmarried and married women. Okay, so then the examination will differ. So the internal examination, which we generally say transvaginal examination, that we offer only when they are sexually active. So in India, generally we say that when they are married, we generally offer them. But when it comes to unmarried, this thing girls or young girls, we don't offer. But then there is a different approach also, which is not carried out in every center, or maybe people are not aware, or it is not offered, because then there is not much of awareness and there is little fear. Which the other approach for that is generally what I do routinely is a transrectal. Now, how this is important? The common knowledge about ultrasound is for every woman when she has any problem, whether it is menstrual related, whether it is a lower abdominal pain, whether she gets more menses or less menses or no menses or frequently menses, whatever may be the problem. When anybody visits for any gynecological complaint, the commonest initial basic investigation which is asked for is ultrasonography of the pelvis. Now, depending, as I said, depending upon the age and all those things, which exactly the mode of the examination, that as radiologists that we decide. That there can be other modes and all that will be in too much of detail. But what generally we look at in a pelvic examination is uterus and ovaries. And on ultrasound, we can look for the structure of the organs, means whether they are structurally, whether they are okay, if there is any some defects which are generally present at the time of birth but they have not been detected, so maybe they are incidentally either found, or maybe the pain or the problem could be related to this abnormal shape of the uterus or abnormal formation of the uterus. That can also be done. And then the ovaries, so whether there is any pathological or abnormal findings, say whether, as you said, there can be a range of things. There can be a polycystic ovaries up to ovarian tumor. Now, mind you, it is the tumor and all those things. Earlier, all those things were there, that if a woman is more than 40 years, only then it should be looked for and all. But now with the with the newer lifestyle and all, these age related criteria are not so. These have become like, we get to see such findings which earlier we used to find in an age group of above 40. Now we get to see them even at a younger age group also. Let's say between 20 to 40 also. So that is the reason for anybody coming to a radiologist, it's our responsibility to look for each and every abnormality, rather than thinking that first only we generally form an opinion that okay, this is that, so young girl, so there is no possibility of neoplasm or something. So that should not be the thing, and every examination has to be done in detail. So then for the pelvic, as I said, either it can be because of the gynecological, now in medical terms, Dr. Shilpa, you will understand, but just to make it simplified for the viewers, we generally divide it into gynecological and obstetric. Obstetric means everything and anything related to pregnancy, and the gynecological means apart from pregnancy for the other problems. So this is all what we offer. So the pelvic examination can be done right from a newborn baby to up to a 90 or even 100 years lady also. With regards to pelvic examination, if we talk about the other examination now, as I just mentioned about the abnormal shape of the uterus, with the advent of the newer technology, now the latest technology on ultrasound, what we can offer if there is any shape or any abnormality with related to the uterus is a 3D sonography. So that's a fantastic additional modality, and we have to have that high-end equipment, and there are special dedicated probes for volume probes we call them. But with the help of that, earlier MRI was a modality of choice to assess and to classify the abnormal shape of the uterus, which is a birth defect. But now with the advent of the latest ultrasound machines and with the 3D volume imaging, we actually now there is no role or no need of getting an MRI done, because MRI becomes a very cumbersome investigation. The duration is very long. Then there are so many other things associated. People may get claustrophobic in an MRI machine and all. So all those things are saved when we just do a simple 3D ultrasound, which is a very, very simple thing and a bedside investigation. This would be just a basic pelvic examination.
So with all these specialist things coming up, it becomes easy for you and also for the patient to undergo these tests, and more easily they can accept the things as they are. So that cumbersomeness and that sluggishness is gone out of it. Now, as we go about, there are two types of tests. Could be diagnostic tests and screening tests. So what could be the screening tests, for women as a part of a normal health checkup?
Okay. See, health checkup, I always compare it with, we are very caring for our car. So when it comes to the taking good care of car, we will always look for the good mechanic or the best servicing center where we would like to take our car, and we would get it done on a very regular basis so that we don't have to face a sudden breakdown. So similarly, I compare that. You compare your own body also to car, and if you are taking so much care for your car, your body and your physique definitely deserves more attention than that. So you must do a health checkup. It's like a servicing of the car when you don't face any problem. So what happens with that? And when you're doing it, don't settle for any package which is economical or which is a very low priced one. Rather, you look at the number of tests which are actually offered in that package, and always go to the good center where you are sure about the quality, the doctor performing the scan, and where there are good equipments also. So all the experience, expertise, and the equipments, all these E's have to be present. So before you choose, you have to look at all these things. And now once you are done with the health checkup, if between the two health checkup, if there is any other problem with related to the health, then of course you have to go for it. It's like between the two servicing of the cars, if you face any other problem in between, you definitely take it to the servicing center. It's like that. Now coming back to the health checkup packages, so the pathology test, yes, of course, you will get a wide combinations and you can really choose which one to go for. But when it comes to the imaging, please you see to it if it's a woman. Now today, because we are talking mainly for the women's imaging, when it is for a woman, it should not be only for the abdominal sonography. Just basically, in any health checkup packages, when it comes to radiology, it is X-ray chest to look for the common this thing involvement. If there is tuberculosis, is very common in our country. You may not be symptomatic, but still it can be found. So that is one reason why X-ray chest is always offered. And secondly is the ultrasonography of the whole abdomen. Whole abdomen means the upper abdomen where the abdominal organs will be covered and the pelvic organs. So when it is for the women, it should not be limited only for men. It is still okay, but for women, irrespective of the age, the mammography has to be included in any of the health checkup packages. Now, depending upon the age, it will be only X-rays, sono, or it will be only sonography. Now, generally in India, we offer the X-rays for all the women above 40 years of age. So if you are above 40, you have to go for mammography also. So as Dr. Shilpa, you mentioned, mammography is generally divided into two groups. Again, two types we can say, a screening mammography and a diagnostic mammography. Now again, I will come back to the servicing of the car. Screening mammography is something that you can compare with the servicing of the car, which you have to get done every year. See, I tell my patients, just to make it very simple for them, I tell them that you fix 1 month of the year. For example, if this is June month, if you're getting your mammography done, if it is a screening mammography, means like a routine mammography when they don't have any problem and they just want to get themselves examined and checked and just to be sure that everything is going well and everything is fine. So that will be a screening mammography. That for that, you fix 1 month. If it is June and if you're getting it done this June, then every June you remember that every year in month of June, you have to come back for your mammography wherever you go. So it becomes easy for you. You will never miss out on that annual checkups. And in between these two screening mammography, during that 1 month period, self-breast examination has to be done, and at least once in 3 months we recommend a clinical breast examination, which needs to be done by an expert doctor. And if they see any warning signs or symptoms after educating them how to do the self-breast examination, then they have to again report to the doctor and should not wait for the next turn of their screening mammography. So it's like to simplify between the two servicing of the cars, if you face anything in between the two servicing, you have to report. So then the doctor will decide. If they come to us, then we decide which investigation needs to be offered. But they should not be ignoring, because the whole idea of doing it, see, mammography doesn't prevent the development of breast cancer. But it helps in detection at a very, very, very early stage. So it improves the cure rate to a very, very significant, and the 5-year survival rate becomes very, very high. In India, if we look at the statistics, I'll just compare this with USA. In USA, the government included the policy of getting screening mammography done for all the women above a certain age. And this program they started in 1980. Now, for them to reduce the rate significantly and to improve the survival, even those who get affected and detected with breast cancer, they took almost 2 to 3 decades. Now, if we compare the same scene with India, there is not much awareness. People are still not aware there is something called mammography. They feel that if I don't have any problem, I should not be going and getting it done. So here we have to go a long way, and because of our population and because of some all the things also, we have limitations. So we cannot include all the women in a government program and get everyone screened for this. So what we have to do, using such forums and such wonderful women like you when they come ahead and when they really want to do something. So this is a wonderful platform for me even to share that what is most important for us is to create awareness, first to tell them that why we require to do this, how to do this, when to do this, and when to report to a doctor in between the two stunning mammogram. So this is what my mission is, and I'm very happy that people like you are helping us out in reaching out to maximum people and women and helping them in detecting the breast cancer at a very early stage and helping them completely to get rid of it also. So this is the most important thing.
Have been doing all these all these kind of programs for the last 2 months to create a lot of awareness, because there are a lot of myths about everything
Yes.
which are so wrong, and there is so much of misinformation and infodemic and WhatsApp encyclopedia and so many things which create more of wrong things rather than this. So I think myths like that mammography is a painful procedure, it is not safe, there is radiation and all that, I think this is all false. It has no value. This is just created a negative hype unnecessarily. So what is very
Just,
important is the person.
just to mention about the radiation part, Dr. Shilpa, if we consider, see, we generally take 4 views for mammography, the X-ray. The X-ray machine is completely a different machine. So, yeah. Am I audible?
Yeah,
Hello?
okay, go ahead. Yeah, fine, go ahead.
Hello?
Yeah, go ahead.
Yeah. So the X-ray machine which is used for routine X-rays and the one which is used for mammography is totally different. In mammography, a very low dose of radiation is used. We generally take 4 X-rays. So if you consider the total radiation which a woman gets during a mammography examination and the radiation which one person gets exposed to while taking an X-ray chest, mammography radiation is much low. And if we compare it with the background radiation means the atmosphere. If we go out in the sun, so the radiation which we get exposed to in a duration of say around 2 months, it's same as one mammography done. So imagine it's so low, and but the benefits of getting a mammography done are so much more. That means if you weigh against the risks and the benefit, means the risks are completely negligible, and the benefits they really outweigh the risk. So but nobody should have this fear in mind that getting radiation exposure and all. It's absolutely a myth.
Right. So as you talk about mammography, so even the smallest thing or the slightest change is all very clearly found and it can be diagnosed in mammography, right? That's what you're saying, telling us?
No, see, we are not claiming that 100% it will be seen, but generally when it is done, see, there are certain limitations. For example, if it is a too much of dense breast, but in these cases, we generally inform the patients that if the breasts are too dense and if the scan is done at a suboptimal level, then we do inform. If there is any family history, then also we do inform. So this is not done for the
Yeah.
prevention. But see, if we don't do anything, if you compare the incidence and the stage at which the woman is going to present, if at all, God forbid, if she gets affected with breast cancer, but if she gets a regular screening mammography done, then of course the stage at which it is going to get detected is going to be at a very, very early stage, and the cure is going to be much, much better.
Yes, because once, as for anything, if you're diagnosed early, you are treated better. Your efficacy about all the treatment later on, which is required, is much better because you will get very good results. Right.
Yes,
So
that's
if
why
we
we
talk
say
about
early. Yeah, please
early
go ahead.
detection,
So
no,
that's
you
why we
finish
say
your sentence.
early detection is the best protection. There is nothing else. No, there is no other modality and there is no other magic. There is no other mantra for protection of breast cancer. Every woman is exposed. Everybody is at the same risk. If there is any familiar or hereditary risk, if there is a cancer running in the family, yes, they have a little more this thing
Incidence.
this thing, yes,
Incidence.
exposure to cancer development. But that does not mean, see, people who get detected with breast cancer, most of them, 75% of them have no family history. So we cannot really categorize it. So there is no way that we can prevent breast cancer, but early detection is the best protection what we can offer.
even some people even say that the lifestyle diseases like diabetes, hypothyroid, all this, they are also linked to breast cancer, or if they have, there is more likelihood. Is it some substance in that, or is it a
No,
question
see,
mark?
there
What
are
is it?
some predisposing factors, definitely. See, with the newer lifestyle and also sedentary lifestyle, obesity, smoking, alcohol intake, and prolonged exposure to estrogen, the hormonal also. It is said that if the menarche, if the first period, if the woman gets at a very early stage, and then if the menopause occurs at a very later stage, then there is a longer period during which she gets exposed to the hormones. So these are, but these are not 100% reasons. We can say that because this increases the incidence to certain level. So they may be at a higher risk of developing it if there is any family history. So all these things we have to put in together. But then if we really change the lifestyle, if suppose if the weight is also it is under control and all those things. So all these things cannot be prevented, but all if anybody is having this, then they have to be more cautious. And if they can do something to control these factors and get themselves examined on a regular basis, then they can definitely this thing be aware of it at a very very early stage.
Wow, that's great. So many things are there, and there is nothing like one single line saying that do this. I mean, this is going to happen because of this. No, you have to be careful. So basically, lifestyle, the way you have your life. So I think diet, sleep, regularity in everything, all these things again play an important part in everything. Right.
Absolutely.
Now, second, as we
Absolutely.
so as we now we take about the example of sonography. Now sonography also, as you said, that it is very important for the abdominal kind of complaints, for pregnancy, matching things, the weeks and all that. I think also for different kind of deficiency. And as you said, you earlier you have mentioned that you have been a specialized in fetal imaging, and you've been doing a lot of study on that. So how do you use this knowledge of fetal imaging to help the people? I mean, are kind of fetal changes or whatever the things happening inside the fetus, can you how can you help the patients with that knowledge? That's what I need to ask.
Sure. So first, I will just explain this to the viewers that fetus, we call the fetus is the unborn baby which is in the womb of the mother. So that's fetus. So fetal imaging, this is a newer this thing specialty which has come up now in last few years, and that is also considered as one of the super specialty. So I, being a radiologist, I have the advantage of doing the sonography for all these things. And so being a women's imaging specialty, I do fetal imaging, gynecology imaging, infertility imaging, and breast imaging. And not only diagnosing it, but if any further investigation required, then we even offer ultrasound guided procedures. For example, as I mentioned, that when we do the breast imaging, if there is any, God forbid, if there is any lump which needs to be biopsied, because on imaging we can only tell according to the appearance what it could be, what is it more likely to be. So we have certain classifications in which then we classify that and say what is a more probability of it being a cancerous one or a non-cancerous one. And when it is suggestive, if its features are suggestive of it to be more likely to be of a cancerous one, then we do provide services like ultrasound guided biopsy. So unless we do the biopsy, unless we actually know what is the cell, what is the histopathology of the lump, we cannot say whether it is a cancer. So that gives a confirmation only by the pathology. So we do offer this. So coming back to fetal imaging, yes, fetal imaging is all the scans which we do during pregnancy. This is to check for the well-being of the unborn baby. Now, earlier, when 20 years back, it was just that, just to know what is a gestation, what is how many weeks the pregnancy is, what is the placental localization, what is the cervical length, what is the amount of the water around the baby. So it used to be very, gross things and limited. But now it has evolved like anything. And what we are trying to do with that is, if there is, God forbid, if there is any abnormality or if there is any problem which for which we feel that the pregnancy may not be continued, or a parent should be warned and given the information about, and the choice should be given to them that in spite of this defect, whether they want to continue with the pregnancy or not. In India, the legal medical termination of the pregnancy is permitted only till 20 weeks of the pregnancy. When it comes to sonography, we don't go by months, we go by weeks. So till 20 weeks only it is allowed. So what we are trying to do is we are trying to assess the baby before this period, so that if there is any major abnormality which is not life compatible, the parent should be informed about it, and they should be able to take a decision whether they want to continue the pregnancy or whether they don't want to. So then it becomes safer for the mother also, because we have to look take this all these things also into consideration, because termination of a pregnancy is also a huge thing for the mother with regards to the health of the mother. So all these things. Now, doing a termination at 20 weeks and termination at earlier than that obviously will have lesser impacts on the mother's health. So the whole idea behind this fetal imaging is how we can diagnose it at a earlier stage, so that we don't even have to wait till 20 weeks, and how earlier, more earlier. So there are few distinct tests which have been developed and invented internationally. Earlier we used to do an anomaly scan. An anomaly scan is to look for all the parts of the baby, because baby is significantly big, it becomes easier for us, and it is not that big also, it is freely moving inside the mother's womb, so we get to see the baby from all the angles. So this was at 20 weeks. So now in last few years, maybe in 10 to 12 years, there has been another this thing test which we offer at 12 to 13 weeks. That means during third month or fourth month. Okay, so here also now we are trying to do the things. There are certain parameters, certain measurements which are mostly associated with the genetic abnormalities. So we try and assess the risk. So just based upon two parameters, it's a wonderful thing. Just by taking those parameters, and there is another blood test also which is called as dual marker. So when we combine both the things, we can actually assess the risk, whether this baby is the risk for this baby to have such chromosomal abnormalities is high or low. And it's a simple test, just a sonography and just a blood test. So it is a screening test. It is offered to all the mothers. And if for any given reason, if the risk comes high, then these are the cases where we advise them to go ahead and get the invasive test. Invasive test means putting the needle inside the mother's womb and taking out the sample, be it either the water around the baby or from the placenta, certain tissues. So this involves 1 to 2% risk of abortion. So that is the reason these invasive tests are not offered as screening tests, but these are limited only to those who have come with the report of a high risk on the scan which I just mentioned, which we offer at 12 weeks. We called as nuchal translucency NT measurement scan. What nuchal means a neck area, and nuchal translucency means the area behind the neck. It has been observed that whenever there is any major genetic abnormality, generally the babies, they generally have abnormal thickening at this part. So this is a part which we made. Now it sounds very simple that we just have to only measure, but the criteria, the guidelines which have been laid to measure this are very, very strict. So there are international guidelines, and we have to be really, really patient while doing this scan. So the baby has to be a specific position, and there are so many other things also which have to be met. But if done in a proper manner, it gives the specificity and the sensitivity of these parameters is more than 90%. It is that accurate. So we can save many, so then they don't have to continue the pregnancy till 20 weeks for them to know whether it is really an abnormal. And even genetics has also evolved. So we genetics, radiologists, sonologists, gynecologists, and the parents, it's like a teamwork. So this is all what we offer. So if you look at all the fetal imaging, the first earlier scan is just a viability scan. We just want to see whether the pregnancy confirmation is there, heartbeat fine, how many babies are there, whether it is inside the uterus, and all those things. Once it is all fine, then the second would be the NT scan, which I just mentioned, which is done between 12 to 14 weeks, associated with the blood test. If all these things are fine, then next they come for the anomaly scan at 18 to 20 weeks. Anomaly scan again is a very long study, and we actually look at the baby from head to toe. Everything is looked at baby. We offer 3D, 4D. So the parents really enjoy seeing the images of the baby. They feel very happy. So it's a nice interaction. They actually get to see the first time the glimpse of the baby in a 3D. Because earlier the soft tissues are not very well formed. So 3D reconstruction is not very appealing. And then later on, it's just a growth scan. We have to keep looking at the water around the baby and the other things, and even the Doppler. So when all this, everything is done in the great detail, and people who are specially trained for performing these scans are called as fetal imaging consultants. So it is not just doing a routine scan, but every step of the pregnancy, every stage of the pregnancy, we have to really do different scans. We have to, from our end also, sometimes we have to advise what exactly they need to be doing. And if anything required, like as I mentioned, the invasive test, we call it as placental biopsy, and we call the other is a amniocentesis. These are the ones which we actually means we put in the needle and we do it. So we offer all these things. There is something else also which we offer, one procedure, like, when there are multiple pregnancies and people don't want to. So to, from multiple numbers, we can reduce it to the acceptable. So to make the pregnancy viable, because as the number of fetuses increase, the babies increase inside the womb, the chances of prematurity also are high. So there are high chances of losing all the babies. So instead of doing that, if we can reduce the number, so that the survival, survival of the remaining babies improves to a great extent. So these all these are the specialized tests which all we offer at our center. So this is what fetal imaging is all about. And I'm very this thing fortunate that one of the first fetal medicine consultant from India, she's my mentor, Dr. Pratima Radhakrishnan. So I have learned it from her, and I have the licenses from UK. I'm one of the few hundreds, maybe 200 currently Indian doctors who are having this license from UK. The UK is a center where these scans were invented. So I am fortunate to have these licenses.
In fact, on the show, we should declare this, that we are fortunate to have one of the doctors. So if that would, unfortunately or fortunately, if we have anybody of amongst us would have this, would think that, okay, we have somebody, we had heard somebody, that is that Dr. Swati. So we are sure, we feel secure, because we know someone who's going to help us ride through that journey properly. Now see, that's where the things lies, because nowadays we need a lot of trust amongst people and amongst doctor patient relationships and things like that. So if we know someone who's doing and that super speciality, it helps us a lot. Because see, as it is in India, we have a lot of population, so there is a lot of paradox. At one side we have a lot of babies, and the birth rate is so high every year, every minute, and at the other side we have a lot of cases which are infertility cases. So it's really a paradox, that how do you deal with all this, so much of contrast in spite so much of things being there. Yeah, so that's fantastic to know about the different kind of scans you mentioned, the anomaly scan and all, and that's very important, because once any abnormal baby, or anything abnormal with the fetus, it's difficult for the parents also, because they
Yes,
have to undergo it for a lifetime. So
absolutely.
for the fetus or the baby and the parents, it's really difficult. And with this kind of uncertainties around, and so many other things, problems coming up, one has to be taking care of all this, and be aware of all this, and do as the doctors say. But yes, they should be following it properly. Wow, that's fantastic. Now something what we find in young girls, this PCOD and PCOS. OS is different. They say syndrome, and they say D is, cis or whatever. So could you just clarify, and what kind of test would reveal that?
Yeah, that's actually a very important question to be asked in this current era. PCOS stands for polycystic ovarian, PCOD, polycystic ovarian disease, and PCOS is polycystic ovarian syndrome. Now, a syndrome, if anybody having what we differentiate between the two is somebody is having this but yet not manifested, not yet symptomatic. So when it becomes symptomatic, manifested, we say it is a disease. No, actually, this term has been really abused, because everybody's so many this thing increase so many cases we see around, so everybody is termed as PCOS, but that should not be the case. Now, it's first of all, it's a misnomer. It's not the multiple cysts in the ovaries. No, it's not like that. These are just the multiple follicles which get developed because there is some hormonal imbalance going on in the body. Okay, so this is the basic this thing what happens in the PCOS. Now, why it happens? And why do we see more cases now only, and we hardly heard about it in the past, is mainly because of the change in the lifestyle. As I mentioned, there is lack of exercise, there is more of sedentary life, the more of junk food intake, and this globalization and all these things. People are just sitting in front of the laptop and all. So all this has made all these things. Now, first and most important thing is it's a genetic thing. Okay, nobody can cure it. Even earlier in the past also this was existent, but why people were not manifested with the disease? Because they didn't have so much of sedentary lifestyle, and the lifestyle was different. We were more, there was more of physical activity. So though people were having it, they were not getting manifested with the disease. Okay, so this is the
Yeah.
difference. And why now it is more getting manifested? Because again, same thing again, because of the lifestyle. So there is nothing that we can prevent it. Okay, but what we can definitely do is we can keep it under control by changes in the lifestyle, like more of physical activity, the diet control, and even the stress also plays a very very major role in development of all these things. Now coming back to PCOS, now in young girls, it's very common. See, when they just get the menarche in the first period, in the first few years, the body has not yet adapted to the newer changes, because there's a lot of things going on in the body. It's not one simple thing. The one hormone has got impact on all the organs in the body. So body takes some time to get completely adapted to these newer changes. So during that time, the periods are many of the cases, the periods become irregular, and there are so many other things. So everything, it is not right for us to put it under PCOS. Now that's the reason now my mentor, Dr. Sonal Panchal, from whom I have learned infertility imaging, she says that in the younger age group, this we should be labeling them as multicystic ovaries, which generally they have got nothing to do with the PCOS, and they generally over a time they completely get the cycles become regular because the body gets adapted to it. So we should be giving that much time. If we really want to diagnose if we really want to diagnose whether it is polycystic, again, there are strict international guidelines how to perform, and the sonography is a modality of choice. We don't require any further imaging, or we can confirm it on ultrasound. So there are certain features which are pathognomonic. This is if this is present, it is definitely a polycystic PCOS. So there are certain features which are already given: how to do the scan, which probe to use, if it is an unmarried girl, if it is a married girl. There are so many technical things also given. So if someone is following all that, and after performing the scan in this given manner, if they get the same, if they get the features which are definitely suggestive of PCOS, only then it should be given as. This is a case in the younger age group. Now we see PCOS more commonly in people, in women, when they come for infertility imaging also. Because what happens, PCOS, the cycles become irregular, ovulation also becomes irregular. So that's the reason infertility, they feel that conception is not taking place. So rather than labeling them primary infertility or any kind of infertility, it is important for us first to assess what is the reason. And if PCOS is the only reason, then there are certain many things for gynecologists, they know how to manage it, and they can be easily taken care of. But for a diagnosis of PCOS, ultrasonography is the modality of choice.
Fantastic. Everything in detail, and for everything as a specialist, whether fetal imaging or whether PCOS or whether mammography, and this, so these are all special things, and hats off to you with all these kind of specialities within one person. So we are lucky enough to have somebody who's aware of everything, who knows everything, so we have easy references. Wow, that's great. So I really, really, really thank you, Dr. Swati, for giving that fantastic loads of information, for even for doctors at that matter, and also for the general public, and to overcome the myth, so that they really use these diagnostic techniques for their betterment and for their prevention, and for postponing of all the things, which unnecessarily would have shattered them in every way, you know by health wise, financially, expensive, everything. So that's fantastic. So I really thank you, Dr. Swati, from the bottom of my heart, for giving this fantastic information. Thank you so much for being
Thank
here.
you, Dr. Shilpa.
Over
Thank
to
you, Mamtaji, for having me here and giving me this opportunity to share my views on this. And I hope that viewers and all the women, they would not now hesitate to come forward to get their mammography done, because it is very, very important. because for all the other ultrasonography, they know that it's a very safer modality, no radiation, involved in that. But for mammography, I don't know they have this, I don't know the inhibitions are there. So please don't be afraid of it. And it's a very simple examination. And once it is done, for at least the next 1 year. So please do come forward and get it. And thank you so much for this platform. I'm very grateful to the CDC platform, Mamta ji and Dr. Shilpa for having me here. It was wonderful, this thing interacting with both of you.
It is really fantastic, because what happens is, even we have to thank the public for listening us for a long time to understand the things. And even if one woman benefits, our purpose is served. So that's
Yes,
it. Over to you, Mamta.
absolutely.
So, I mean, I really enjoyed coming from non-medical part. I really enjoyed the session because there were too many things. There's a, half knowledge is always dangerous. So, I thoroughly enjoyed the session. Before getting into the session, I was little, not easy, but yes, throughout the session, it was the kind of energy and the kind of knowledge, the expertise what shared. And you rightly said the 3 E's should be, kept in mind when it comes to medical. You mentioned the experience, expertise, and the kind of equipment the institute is using. So yes, of course, we get one life, and with this one life we should not be ignorant about the fact that I mean, you just mentioned one example. I could say every birthday a woman should go to a diagnostic center and get examined herself, and that would the best gift what she can give to herself. That yes, and I mean, yes, life is uncertain, but if we can detect it, so the survival, again, what you mentioned was, it can be prolonged and can be treated for that matter. So thank you so much. It's our pleasure to have you, and I think it was a multi I mean, Shilpa ji, you can term that thing. What I want to say, it's like a bundle of thing in one package. So,
Yes.
I mean, it's really an honor for us to have you, to listen to you, and I'm looking forward for women's. Please enjoy this session and take a lot of learning. Take a positive step towards your life, of course. And this is something really important. And I would request to Dr. Swati, what we conducted this session, maybe 2 months or 3 months down the line, we should have one session in Hindi, which would help us to reach out to thousands and millions women who are sitting at home and who can listen to us and take a lot of information, because there are hundreds of institutions who are conducting such things, but women's, they themselves, or the family, they themselves don't know about what is it, and that's the reason, and there is a communication gap in between. So I think we as a Wiki platform, we want to become and we want to remove that communication barrier with getting these information, these kind of awareness in Hindi, so that we can reach out to whole of India.
Women.
Yes,
Many women. Yes. And I would urge all the women, because the woman is considered as a pillar of strength in the family. So if you really care for your loved ones, it's high time that you start taking care of yourself first.
Yes. So with that, I take an opportunity to thank Dr. Shilpa also, because she is contributing a lot to this segment, and she is bringing up a lot of wisdom, a lot of knowledge, which is helping us to share with you all. So stay tuned with us. We would be coming with a lot of knowledge across India, across the globe, on the similar lines. And yes, that is something our vision is. Thank you so much. Thank you so much, Dr. Swati, to join us. Thank you so much, Dr. Shilpa, to join us. Thank you.
Mamta ji, you got to announce the further things. Announce the further things.
Okay. So, yes, there is an announcement. This Thursday, we are coming up with global healthcare Summit 2021. And yes, we are excited for the same. Looking forward for you to join us through virtual forum. We would be sharing the link and would like your feedback, your comments, and we would request if you like the session, we would put it across on YouTube channel and kindly share that to your family, your friends, and colleagues, so that we get lots of love and we help you with a lot of wisdom. Thank you so much.
Thank you.
Thank you.